Robert Koch. He provided remarkable contributions to the field of microbiology. He was a German general practitioner 1843 to 1910. His contributions are as follow. Robert Koch introduced solid media for the culture of bacteria. Ilsimus Hisi, the wife of one of Koch's assistants, had suggested the use of agar as a solidifying agent. He also introduced methods for isolation of bacteria in pure culture. Methods of isolation of bacteria in pure culture. He described hanging drop method for testing motility. So he introduced solid media, described the hanging drop experiment, also introduced methods for isolation of bacteria in pure culture. He discovered bacteria such as anthrax bacilli, tubercle bacilli, and cholera bacilli. He discovered bacteria like anthrax bacilli, tubercle bacilli, and cholera bacilli. He introduced staining techniques by using aniline dye. So he introduced staining techniques by using aniline dye. Koch phenomena. Robert Koch observed that guinea pig, already infected with tubercle bacilli, developed a hypersensitivity reaction when injected with tubercle bacilli or its protein. Since this observation is known as Koch's phenomena. So he observed that a guinea pig which was already infected with a tubercle bacilli, it developed hypersensitivity reaction when it was injected by tubercle bacilli or its protein. Koch postulate. Robert Koch had postulated that a microorganism can be accepted as the causative agent of an infectious disease only if four criteria are fulfilled. The criteria are as follows. The microorganism should be constantly associated with the lesion of the disease. Okay. The microorganism should be constantly associated with the lesion of the disease. It should be possible to isolate the organisms in pure culture from the lesion of the disease. It should be possible to isolate the organism in pure culture from the lesion of the disease. The same disease must result when the isolated organism is inoculated into a suitable laboratory animal. So, the same disease should result when the isolated microorganism is inoculated into a suitable laboratory animal. It should be possible to re isolate the organism in pure culture from the lesion produced in the animal. An additional fifth criteria was later introduced, which states that antibody to the causative organism should be demonstrated in the patient's serum. Exception to Coates' postulate. It is observed that it is not always possible to apply these postulates to study all infectious diseases. There are some bacteria which do not satisfy one or more criteria of Koch postulate, like Mycobacterium leprae and Treponema pallidum. They cannot be grown in vitro. However, they can be maintained in experimental animals. So, Mycobacterium leprae and Treponema pallidum. These cannot be grown in vivo, but they can be maintained in experimental animals. So, exception is Mycobacterium leprae and Treponema pallidum. Then Neisseria gonorrhoeae. There is no animal model, however, it can be grown on vitro. So, the exception to Koch postulate are Neisseria gonorrhoeae, Mycobacterium leprae, and Treponema pallidum.